Hi, my name is Steven Simplegarin, and today we'll be going over validation for bathing a patient in his bed. First thing I'm going to do is come in, introduce myself, close the door and curtains for privacy for the patient, wash my hands, go ahead and introduce myself to the patient, identify the patient with 2 forms of ID, first name and last name, and also date of birth. I'll explain to him that I will actually be giving him a bath, check any doctor's orders for anything that needs to be done, and I'll get started. So the first thing I'm going to do is wash my hands and then put on clean gloves. After I have done all the other 7 procedures, and then I will raise the bed to a working height. Raise the bed. First thing I'm going to do is cover the patient with another towel or a bedpan, and before that I will offer him a bedpan. See if he needs it. If he doesn't need it, fine. We'll continue with the next process. Cover him up. So I will remove the dirty linen underneath. Still covered up. Dispose this in a hamper. Should be over here.
Hamper.
Hamper over here.
Yeah, that's good.
Next thing I'll do is put the side valves down. And assist the patient with taking off the old gown. Make sure he's still covered. Slowly assist him. By doing so, making sure any IVs or anything are still intact and not actually disrupting anything. Still maintaining the patient covered. Same thing with the dirty linen. Dispose of it in the hamper. So now we'll raise the side rails back up. I will go fill the actual basin with water, about halfway full, 2/3 full, and actually assess the actual temperature of the water with the patient, making sure it's comfortable for him. So you usually either place the hand and ask him if it's comfortable for him. If it's good, we'll proceed. Comfortable for the patient. Place it right over here. So I will start off with his head, starting off with his eyes as well. So put this down again. Also place a towel underneath the patient's head. Just ask him to lift his head up. Good. Then I will fold my washcloth to mid. Now when I do the patient's eyes, I will not use any soap, just water. And when I am washing around his eyes, I will use a different area of the towel for each eye. I'll start off with the inner canus, work my way out, so gently doing that, then using the other side. Okay, I'll do that. Rinse some water, get some soap, because now I will do the forehead, the cheeks, around his neck, and by his ears, checking also for any sort of bruises or any sort of drainage around the ear. So I'll do that. Zoom around here. And also for any sort of skin integrity violations, making sure everything is good. Okay. Done that. Just rinse some more water out. Next, I will do the patient's arm, starting with the arm closest to me. So I'll also get this towel again. Let the patient head up. I'll place this towel as close as possible to the actual patient. Lift his hand up. And as I'm doing this as well, I'll also check for skin integrity, reporting anything that is different, any sort of swelling or any actual integrity loss. So we'll start off again with my mitt. Some water. So we'll start off with elbow, making sure I support any bony prominence. Work my way up to the maxilla, and then from his elbow down to his hand, and then I will rinse with another washcloth. Same thing. Just rinse down. Again, just making sure, checking for any skin breakdown, making sure everything's still intact. Do that. Sear. And then I will dry patient. Another towel. Do that. Now we'll go to the other side. Repeat this to the other side of his body. Just grab all my actual towels that I'll need for the other side. Move over to the other side. Just make sure this side rail is back up. To the other side. Again. Bring down the side rail. Place the same towel that was underneath. The other side, on this side as well. Again, check for any skin integrity. Everything seems fine. Same thing, using the same washcloth that I used to scrub. Same thing. Scrub up, axilla, and then down. Use the other one to rinse as well. Although the glove, this washcloth could come out of its form of being a little glove, you just have to refold it back in. Same thing. And checking integrity as well. I'm done. Dry off the patient's arm. Okay. At this moment, also assess the patient's hands and nails. If they need to be scrubbed or anything, I'll use the little orange stick. Get the patient's hands nice and wet. Actually scrub gently. Also, when I'm done with the arms, I'll also offer the patient deodorant or any sort of talcum powder or any lotion if you would like. Okay, so next, I will grab this towel again, and I will expose a little bit of the actual patient because we are going to move on to the chest and breast area. I'm doing that, I'm covering back up. Just move the bath towel for that. We'll also change the water if necessary. Go in there, get my washcloth ready. Okay. Expose the upper chest and assess for any sort of skin integrity. Then just same thing. Actually wash down, scrub a little bit with soap and water. As I'm doing that, rinse with the secondary washcloth. Dry off as well. And we'll cover the patient back up. I'll go now to his abdomen area. Same thing. Scrub down. Assess the actual skin integrity. Rinse off. Rinse. That's good. Dry out the patient. That's good. What to do? Cover him back up. And back up with his actual bath towel. Bath blanket. Do that. Okay, getting ready to move on to the patient's lower extremities and then his back as well. First we will do the lower extremities. And before that, we do his back. So what we do is have the patient roll to the far side, bending his knee here, and assist them in 1, 2, 3. So do that, making sure the patient is still covered, just for privacy. Make sure he stays there. Also place another towel as close as possible to him. Get my washcloth ready. Start to scrub down from the neck down to pretty much the buttocks, making sure, and also assessing the skin for any sort of integrity breakdown. I've done that. Rinse some water off. Rinse. And then dry. Roll that. I'll also apply any sort of lotion or anything if the patient needs it, and offer the patient a back rub just to kind of relax a little bit. Do that. Okay. Roll him back to his back. Make sure. Okay. Now we're going to move on to his lower extremities. Same thing. Start on this side. not going to expose them too much. I'm just going to start from the leg down. I'm going to move the towel over here. Come up the arms. Let's place the towel underneath here. Okay. Get an actual washcloth going. Same thing, just start from the back of the knee to the thigh, all the way up to the thigh, and then from the back of the knee all the way down to the ankle. Assessing for skin integrity breakdown, like that. Going to rinse, same procedure, and then down. Dry off. Move this towel from underneath here. And cover the patient up because we're going to move on to the other side. Side goes up. Keep moving over. This side. Side rails. This side up. Place towel. Leg. And use your scrubbing washcloth. Then start scrubbing gently. Again, assessing for skin integrity, making sure the patient's still comfortable. Do that. Then I will rinse off. And lastly, dry. Okay. Done with the lower extremities. Remove this towel. Now I'm going to go change the bath water, the actual bath water. Get different water. Side rail back up. Once I do that, I come back, making sure that the actual water is the comfortable temperature for the patient. Again, having him dip his hand in, making sure it's good for him. Pull that. Roll the side again. Get ready to do the peritoneal area. Also place a towel underneath, so I'm going to actually prop him up. Not revealing too much. Check if the patient has any sort of indwelling catheters or if there's any maintenance that needs to be done. That's that. Same thing. Scrub washcloth. Scrub the meatus from front to back gently. Do that. Assess as well for any sort of skin breakdown. If the patient has any sort of incontinence or anything like that, just to make sure there's no irritation in the skin. Do that. Also rinse off. Do that. And dry the patient off. Okay. That's done for the peritoneal area. And lower the patient back down. Cuff him back up. Take this towel from underneath him. Now, just make sure there's no actual integrity loss with any of the skin and the feet. Wash those off as well. No pressure ulcers. Now I'm going to assist the patient with a new gown. Since we're taking that one off. So I'm ready. So I will assist that. So I'll get his arms in first, still maintaining privacy, not exposing him too much. As you're doing all this, just making sure your patient is comfortable. No pain or nothing like that. It's covered here. Tie the actual gown in the back. Lower it down. Get rid of the old bath towel that was over him. Just gather it up with all of your other supplies. Get it ready for hamper. And then I will actually remake his bed and cover him back up with another top sheet. Making sure he's still comfortable. Make sure. Raise this back up. Assess the patient again. Lower him down all the way down. After he's all the way down, I will document any sort of changes to his chart, any abnormalities, or anything that I found with his skin integrity. So get rid of my gloves.
First thing you want to do is check the doctor's order. Make sure you wash your hands. Make sure you have gloves on. And you're also going to raise
Discard the trash, wash my hands, and that's it.